think most people who've heard of Sjögren's have heard about the dryness symptoms primarily of eyes and mouth, but over 50 to 60% of people with Sjögren's also have systemic symptoms, or also termed extraglandular symptoms that can affect multiple parts of the body, and they don't often all occur at the same time. And they can be quite variable as far as from patient to patient. There's doesn't appear to be a set pattern. In some ways it breaks down into a simple 1/3 rule. A third of people will have, sort of mild, annoying symptoms that may fluctuate and come and go over time, but never develop anything severe. A third of patients may have, one or two areas that seem to be quite dysfunctional for them, and that may be their same pattern over time, or they may actually have one thing that's annoying and then go away and not be annoying and develop another system. But it's all manageable. And then another third who may have a more severe process where things are, more significant, may need more medical intervention, and may not have periods of significant remission and may progress. I really thought I would. When a patient's first diagnosed, often, fortunately, there's a real sense of relief. There's finally an explanation, a name that they can put on, a mystery illness or a diffuse symptoms that they've had. Then that's usually followed by, but this is chronic and it's autoimmune and we don't know how to make it go away completely. And yet to be determined is whether symptoms are going to respond to management and whether the quality, of life is going to be, any better.
Learning more about the disease, working with your doctor, and connecting with other people you can share experiences with will help you find options for managing your symptoms. While no one experiences all the possible symptoms of Sjögren's syndrome, they can include fatigue and joint pain, concentration and memory loss, also known as brain fog, dry mouth, mouth sores, dental decay, difficulty with chewing, swallowing, speech, taste, and dentures, dry nose, recurrent sinusitis, and nosebleeds. GI problems such as stomach upset, gastroparesis, autoimmune pancreatitis, heartburn, reflux, and esophagitis, dry skin, vasculitis, and Raynaud's phenomenon, peripheral and autonomic neuropathies, dry eyes, corneal ulcerations and infections, recurrent bronchitis, pneumonia, and interstitial lung disease, abnormal liver function tests, chronic active autoimmune hepatitis, and primary biliary cirrhosis, vaginal dryness, and painful intercourse. Sjögren's can also affect the central nervous system, can cause fetal heart block in babies whose mothers have Sjögren's, and can sometimes lead to the development of lymphoma. That is why it is so important for the patient to be followed by a physician who understands the signs and symptoms of Sjögren's syndrome.
There is no evidence at the present time in any manner scientifically that Sjögren's syndrome is contagious. And secondly, a very important question that people ask is whether or not their longevity will be decreased by Sjögren's. And the feeling is that Sjögren's does not decrease longevity at all, which is really good news for patients.
Managing your health with Sjögren's syndrome includes the fundamentals of good health for all of us. It's important to eat a well-balanced, anti-inflammatory diet based on the Mediterranean diet model, which includes lots of whole fruits and vegetables, whole grains, less meat and dairy, and very few processed foods. A good exercise plan is very important, tailoring it for what works for you. It may be running, walking, yoga, or Tai Chi, but it should be something you can do regularly and with pleasure.
But one size won't fit all. And so it's what are the options that you can learn about, gather from, healthcare providers that you're seeing, and then try some for you. And ultimately, it has to be something that works for you, because that's the only way you're going to do it. If lifestyle management symptoms aren't enough to, or lifestyle management isn't enough to improve symptoms, we have a mild medication with a good safety profile that's not a steroid, that can help with some of the underlying symptoms. It works at the cause of the disease. So we have that available, and often that can help the fatigue, joint pain, those type of symptoms. Sometimes if people are having skin rashes, it can also help that. And then if somebody's having more significant active disease, whether it be lung involvement or really significant joint pain, or you're trying to sort out what's reversible, what's may not be as easily reversible, priming the immune system, sometimes a very short course of steroids can be helpful.
Talk to your physician about the various prescription and over-the-counter medications that are available to help alleviate symptoms such as dry mouth, dry eye, joint pain, and fatigue. Then you and your rheumatologist can develop an individualized treatment plan.